The project represents 4 years of work by the two associations, which has culminated in this 23-page report. The main purpose of the report is to get people talking openly about drug abuse in a way which will lead to a new approach. It advocates some controversial theories based on the belief that countries which have introduced drug regulation or decriminalization have not seen a dramatic increase in drug abuse, but have seen the underground crime organizations losing control over the drug trade. ERG and Stay Clean believe that a regulated drug environment, phased in over time, is a courageous approach to drug abuse in our society.
I'm a firm believer that people like us who advocate better things for the community should take a stride forward, and we are here to help the government. We are here, we've made proposals, we are here to help them. So that is why we are presenting these proposals, because we believe in that.
We're talking about regulation. We're not talking about legalization. We're not talking about decriminalizing. Regulation is a very specific, nuanced approach, looking and studying on a hard, evidence-based manner what the actual effects are, how to reduce harm, and how to avoid a free-for-all, which is what we have now with the mafia gangs that provide every kind of drug, every kind of availability to people. We want the government and we want the authorities to be the ones that are in control, because this is a public health issue above all.
I would never advocate for a free-for-all coffee shop where people can smoke cannabis.
Well, no, but you're advocating regulation of drugs.
Well, in a sense, maybe there would be two things that I wouldn't mind as a recovering addict and as a person who for example, methadone. Methadone, instead of people having to go to Spain and get their methadone, the methadone could be prescribed in the primary center.
The groups have put forward some other ideas, including the creation of a community-based wellness clinic, incorporating the drop-in centre manned by Stay Clean, as well as Bruce's Farm, which would combine the medical approach to drug consumption with screening for sexual health.
This wellness clinic would work. I would really like the process of admission into Bruce's Farm be reduced to the 24-hour period, where the person can be assessed immediately, taken to the primary care center or the wellness clinic, blood's taken out, and I would really advocate detoxification not to be done in Ocean Views, but to be done in Bruce's Farm, like it was originally done when I was part of the first team to open up Bruce's Farm. I wouldn't want to see parents that call me wait for 3 weeks or 5 or 6 weeks. It's not good. It's detrimental for the patient. It's detrimental for the family.
The report will now be presented to the Chief Minister, who just after the 2015 election took on the responsibility for drugs, and the Minister for Health for consideration. The groups say they have no fixed agenda other than wanting to see positive progress.